I'm here because over the years I've noticed the lower lids sinking, like just that heaviness. Years of partying, I'm sure, have contributed to that. Also, just genetically, like my mom had that as well, and she had her lower lids done. I feel like I know how precise you are, I know how much you care, I know like what an expert you are. So that's why I'm here, because I know you're the man and I totally trust you. I wanted to just kind of see what my options are.
This is a very common issue. I'm going to explain exactly what's happening here. When it comes to lower eyelids, there are two things in general that make someone a candidate for surgery. The first thing is having a lot of extra skin. Kind of like how the upper eyelids can get hooded and hang. The same thing happens in the lower eyelids, but it doesn't cause hooding. It just creates a lot of skin redundancy here. It just makes us look a little less fresh, a little less youthful. You don't have that. So excess skin is not an issue in your case, which is a great thing. The other thing that makes someone a surgical candidate is bags. What people typically see as puffiness to the lower eyelids. You have a little bit of that. Now, what's happening there is we all have fat in the lower eyelids. If you put your finger right here, you feel the rim of a bone. And then right above that bone is some fat that kind of cushions the eyeball and does some other things. In some people, the barrier that holds that fat back is a little bit weaker. Some patients have more fat than others. And with age, like everything else in our body, things get a little bit weaker. So that barrier that holds the fat back weakens, and we can see a little bit more of that fat. You have a little bit of coloration issue in addition to bulging fat. The skin of our lower eyelids is much thinner than the skin on our cheeks. And because it's so thin, it's a little bit translucent. And the muscle behind there is this very hardy red muscle. And most of the time it's that translucency that creates a little bit of a coloration issue. So you have a few small issues that are creating a very subtle suboptimal look to your lower eyelids. The goal in your case is we're going to remove a very precise amount of fat that's causing that little bit of a bulge. And then I'm going to use a little bit of your own fat to camouflage a little bit of that coloration issue. And that's pretty much it. There are no external skin incisions. Everything's done through the inside of the eyelid.
Great.
And then I'm going to take a tiny bit of fat from right here through a needle hole, and I'm going to use that to lay a very thin blanket of fat under the skin to camouflage some of that coloration and also some of that subtle undulation that you have. We need to start treating the skin of your lower eyelids. We can kickstart that with a little bit of lasering. In general, you have pretty hardy, nice, thick skin.
I see this with my clients all the time. You don't realize the day-to-day micro things that are going to add up to give you the results that you want.
And if you've ever seen someone who's had lower blepharoplasty, you can't really put your finger on it, but they look different afterwards. What happens is, as the lower eyelid's healing, that contraction during healing can cause a little bit of downward pull and a little bit of rounding of the lower eyelid. We do not want that at all. That makes people look different. You're going to have a supportive stitch from the lower eyelid to the upper eyelid that's going to make you look Asian for 2 weeks.
And it is hard to assign a percentage, but what percentage improvement would we be looking at?
I think we're looking at 75.
Okay.